COVID-19, our response. In the wake of the coronavirus pandemic, the UEA family have been coming together to offer vital help. For people around the world, 2020 has been one of the most difficult years ever faced. The death toll continues to rise, health systems are overstretched, and global lockdowns threaten livelihoods. Yet there has been positivity in the face of adversity. With a common goal to drive us, the UEA family has drawn even closer and aimed our resources towards research, support and solutions. David Ellis, Director of Development, said, "UEA is pulling together to face this challenge, both for our students and the local and global communities. It has undoubtedly made us all stronger and wiser." I've been humbled by the generous response of our alumni and supporters. In just the first 3 months of the crisis, the COVID-19 Student Hardship Fund raised £80,000 and the COVID-19 Research Fund reached an astounding £270,000 to allow UEA scientists to respond at pace. 2 of the first projects made possible by the COVID-19 Research Fund were led by Professor Bill Fraser and Dr. Stuart Rushworth. This extraordinary generosity is now funding the production of an antibody test by Professor Bill Fraser, head of Norwich Medical School at UEA and a consultant metabolic physician and chemical pathologist at Norfolk and Norwich University Hospital. Professor Fraser's test, which detects whether a patient has had the virus before and since recovered, will be crucial in the long-term recovery from the pandemic. It could help NHS, care home and other key workers return to work safely and help the general population return to their daily lives. Philanthropic support from Norfolk, Suffolk, Essex and Hertfordshire Freemasons and the Lugden Hill Charity provided the specialist equipment needed for the team to scale up testing from 600 tests to more than 2,000 per day. Dr. Stuart Rushworth, Group Leader for Molecular Haematology Research at Norwich Medical School, worked to produce coronavirus tests and is now developing a new way to detect those with an infectious virus. Previous tests determined whether or not a patient had already been infected with COVID-19, but couldn't tell if it was live, replicating and dangerous to others. That meant long periods of quarantine for everyone, regardless of the actual risk. Dr. Rushworth's new polymerase chain reaction swab test stands to change that. This vital work, funded by Norwich Consolidated Charities, the Geoffrey Watling Charity and other supporters of our COVID-19 Research Fund, could be a key difference that helps avoid future lockdowns should the virus resurge in the coming years. Professor Paul Hunter, Professor in Medicine at UEA, has been a major voice in the UK media on COVID-19 and an advisor to the World Health Organization. His research has most recently focused on the effectiveness of the use of face masks in the prevention of disease outside of a hospital environment and the impact of fake news or misinformation on disease outbreaks. I am one of hundreds of experts across the globe who provide advice and documentation for WHO to advise on infection prevention and control, said Professor Hunter. Misinformation means that bad advice can circulate very quickly, and our research showed it can change human behaviour to take greater risks. It's absolutely vital that experts do media work because we have a responsibility for public health. I've been pleased to see many others at UEA also taking on this role through the crisis. Alongside our commitment to support the scientific and medical response, we were also concerned about student welfare. The COVID-19 Student Hardship Fund was launched with the utmost urgency. At UEA, we acted to shut down our campus and move to online teaching, tutorials and assessment. Health and well-being was our priority, but nevertheless, some faced difficulties as a consequence. The government's unavoidable decision to temporarily close local businesses, which employed many UEA students, left many out of work and without the income they relied upon to fund their studies. Halls of residence fees were waived, but many students renting privately risked falling behind in their payments. Those travelling home from abroad faced huge airfares to return. For some, simply buying food and basic essentials soon became an enormous burden. We also saw the effects of digital poverty, as the closure of the library meant a number of students lost their only access to a computer, leaving them no way to study online. UEA soon received a rapid rise in requests for urgent financial aid to the existing Student Hardship Fund. In the 3 months following lockdown, our generous supporters gave £80,000 to support the creation of the new COVID-19 Student Hardship Fund. This generosity helped us respond to the need more quickly and provide access to financial assistance with basic living costs and vital equipment needed to complete studies. We are deeply grateful for all gifts to the COVID-19 Student Hardship Fund, which is safeguarding students and supporting them to continue their education. In response to the national emergency, we also set about putting our campus resources to use. Our scientists turned dormant teaching laboratories in the donor-supported new science building into sanitiser gel factories. With help from the Lord Lieutenant for Norfolk, we worked with regional brewers and distilleries to create hand sanitiser for regional NHS trusts and foundations, local authorities and local cancer patients. A project to 3D print parts for personal protective equipment helped provide supplies at a local and national level in partnership with healthcare providers and businesses. Now vacant UEA halls of residence were made available to local NHS workers as temporary accommodation, and NHS essential workers were offered childcare in our closed sports park too. Louise Cooper, a radiographer in the breast imaging department at NNUH, said, "I cannot express how valuable the sports park has been to me and my family. It has allowed me to come to work and contribute to fighting COVID-19 and meant I can feel happy that my children are experiencing fun and normality during this strange time. The staff are amazing and the children cannot wait to get there in the morning. I cannot thank UEA and its supporters enough. It has been the saving grace for our family." Fifth-year UEA medical students also worked on the front line in hospitals. Others volunteered as childminders for NHS workers, and our student nurses took on additional hospital placements, offering vital emergency support. Our actions during the hardest times define us. Thank you to everyone in the UEA family, including supporters, students and staff, for your relentless efforts that help to protect our hospitals and save lives.